Hi, I'm Dr. Colley, and this is a video to help you prepare for your surgery. Let's talk about some things you can do before and after surgery to ensure a smooth recovery. Let's start with some things that you can do to reduce the amount of bacteria on your skin. Number 1, Hibiclens showers. Hibiclens can be purchased from the pharmacy. The minimum is taking a shower the night before and the morning of surgery. Specific instructions are provided in your surgical packet. Let's talk about everybody's favorite topic, the sling. The sling will either be obtained from a medical supply store or given to you at your preoperative appointment, depending on your insurance. Either way, you need to bring this to the surgery center or the hospital and will be applied after surgery. You must wear your sling at all times unless otherwise directed after surgery. You can remove your sling for bathing, eating, and doing your home exercises. Driving after surgery is a big question. I recommend nobody drive for the first 2 weeks after surgery while wearing their sling. You also need to stop narcotic pain medications prior to driving. I recommend every patient assess their fitness for driving after their 2-week appointment and make that decision themselves. Let's talk about some postoperative medications. Everyone will be sent with a narcotic prescription. This can be either oxycodone or hydrocodone depending on the discussion you have with your provider at your pre-op appointment. We also encourage our patients to take Tylenol in addition to their narcotic pain medications if those are not already included in the prescription. If your prescription does not include Tylenol, we recommend 1,000 milligrams 3 times per day. Do not exceed 3,000 milligrams of Tylenol per day. This is important. If you have liver issues, do not take Tylenol. If appropriate, you may be prescribed an anti-inflammatory post-surgery to help with pain. This is often ibuprofen. This is typically given for the first 3 days postoperatively. After that, I recommend you avoid for the first 6 weeks as this can slow healing of tendons. We'll also give you a medication to prevent nausea after surgery. This is typically Zofran or ondansetron. This is as needed as not everybody has nausea after surgery. You will also be prescribed an antibiotic called doxycycline. This is to reduce the amount of bacteria and help prevent infections. This is taken for 5 days preoperatively and 5 days postoperatively. Benzoyl peroxide. This helps reduce the amount of bacteria on your skin. This is prescribed to be applied to the armpit and the front of the shoulder for 5 days leading up to surgery. There are a number of over-the-counter medications I recommend you have on hand just in case. 1. Benadryl. Benadryl can be helpful for sleep, as that's often difficult after surgery. It can also be helpful with itching caused by other medications. 2. Colley. We recommend all patients start Colley if they're taking a narcotic medication. This can help prevent constipation. I also recommend you have Miralax on hand in case the Colley isn't helping. If you continue to have constipation, please call the office or look at your preoperative packet for more instructions. Let's talk about some supplements and nutrition that can help you heal after surgery. Surgery stresses the body. It's important to get proper nutrition and supplements post-surgery. It has been shown in multiple studies this can help speed your recovery. Number 1, protein shakes. I recommend everybody gets on a high protein diet. This is a minimum of 100 grams of protein per day. Number 2, vitamin D. Vitamin D helps support healing and bone health. I recommend 2,000 units per day. Number 3, vitamin C. Vitamin C is vital for immune and healing support. 500 milligrams of vitamin C per day for the first 6 weeks after surgery. There's information in your surgical packet about a company specializing in postoperative nutrition. This is not required, but I do encourage patients to check it out and see if it makes financial sense for them. Also, our practice offers nutritional counseling if you're interested. Please ask us about nutritional counseling and we're happy to set you up with an appointment. Let's talk about some common postoperative questions. Bruising. This is very common after shoulder surgery. It typically starts at the shoulder and moves its way down to the elbow or the hand. Swelling is also common after surgery. This often moves its way down to the hand. I recommend using the stress ball on your sling to help prevent that. Ice. Ice is your friend after shoulder surgery. I recommend everybody have at least 3 reusable ice packs to apply to their shoulder as often as they'd like. Frozen vegetables also work nicely. If you're interested, we also have ice machines available for purchase. Heat. Heat can be helpful after surgery. I recommend you avoid it for the first 2 weeks. Once you begin physical therapy, this can be helpful to warm up the shoulder prior to stretches. Sleep is one of the biggest challenges after shoulder surgery. You can sleep however is comfortable as long as you keep your sling on. Often, patients will sleep in a recliner, adjustable bed, or prop themselves up with pillows. Either is fine with me, just know it's going to be rough for a while. Let's talk about showering after surgery. If you had an arthroscopic surgery, you can remove your dressing 2 days after surgery and apply waterproof bandages to the incisions and shower normally. If you had an open procedure, we recommend you keep your dressing on and dry. If it becomes saturated, please call the office. This dressing should be waterproof, but oftentimes they can still leak. I recommend patients cover the bandage with saran wrap prior to showering. If you have any problems, please call the office. Let's talk about the exercises that you can start after surgery. Your postoperative packet details these exercises. You can begin these on post-op day 1 or 2 whenever you feel comfortable. I recommend you remove your sling 3 times a day to perform your exercises. Finally, please read through your surgical packet. It has additional things that will help with your recovery. If you have any questions, please reach out to me or my staff for clarification. Finally, I take your recovery very seriously. I want to ensure that you have the best post-operative outcomes. If there's anything we can do, please let us know.